Hello, my name is Professor Margaret Kruk, and I am delighted to be with you today. I have the honor of chairing the Lancet Global Health Commission on High-Quality Health Systems, together with Dr. Mohamed Pate. We are 30 academics, policymakers, and experts from 18 countries working to redefine quality for the SDG era. As part of that work, we aim to define health system quality, describe its level across SDG conditions, propose measures, and identify what approaches might work best for improvement. So to start with, what do we mean by quality? The Commission defines a high-quality health system as one that improves health by consistently delivering care that can improve health, by being valued and trusted by all people, and by responding to changing population health needs. Most critically, we think health systems are fundamentally for people and should be primarily accountable to people, not managers, not doctors, and not bureaucrats. And so in our analysis for the Commission, we start by looking at the care that people get. First, we ask whether people get competent care. Are they getting timely treatment? Is the treatment that they're getting in clinics evidence-based? What is the patient experience? Are people being heard? Are they respected when they come to clinic? We then look at what that care achieves. First and foremost is health. Are people getting better? Better survival, better function, fewer symptoms. But we also think that high-quality care promotes confidence. Do people trust the system? Do they want to come back? Would they recommend care? And then there are the economic benefits. We know that people who are healthier are able to go back to work or school faster, earn a living, and support their families. So we are near the midway point of our commission, and we are still collecting some data, but some patterns are already becoming clear. For example, we see that adherence to evidence-based care in many low-income countries is quite low, 30 to 60% of recommended items per visit. We also note that it's worse for poor and rural populations. In addition, patient experience is often negative. Visits are short, patients' concerns may not be heard, or in the worst case, patients are actively disrespected or even abused. And at the same time, we're drowning in measures, but probably of the wrong kind. We're doing too much measurement of inputs like drugs and stethoscopes, and too few measures that matter to people, mortality, function, or measures that can promote accountability, like the extent of respectful and competent care. And improvement strategies have been disappointing as well. They have often addressed the clinic or provider level, but have not really involved people in communities, and they have not succeeded in transforming health systems at large. In short, we're stuck in a low-level equilibrium. What do these findings imply for universal health coverage? Well, to start with, if UHC is to improve health, we'll have to do much more than expand coverage or insurance. We'll have to tackle quality, not as a side activity or something that we'll get to later, but as a central concern in a UHC package. Practically speaking, this requires a minimum standard of quality that needs to be developed for every UHC benefit package, a standard that lets people know what they have a right to expect when they come to clinic. But here's a paradox. After decades of experience with poor care, we're finding that people's expectations are low. The people are content to leave the clinic unscathed and may be holding a prescription. They may complain to family, but when asked, many people say they're satisfied with the care they got. Our contribution as academics will be to describe and analyze the quality of care available to people. But for change to happen, we will need people who can use these results and do something with them. We need people to demand more, to demand better quality. Looking back, the greatest strides in healthcare happened when people put pressure on systems. Passionate AIDS activists expanded antiretroviral treatment. This is an excellent example for us to follow. It's time now for a quality revolution, supported by evidence, but led by people. We won't reach the Sustainable Development Goals without it, and we certainly won't have the care that people deserve. Thank you.